your podcasts.
They're fun.
They are. People love them.
All right, we're live. Here comes the intro.
You're listening to the Grow Clinton podcast. Grow Clinton is a 501c6 nonprofit economic, community development, and tourism organization based in Clinton, Iowa. For more information, visit growclinton.com. Again, that's growclinton.com. Now, back to the show.
What's happening, everybody out there in podcast land? Thank you for joining us for the 95th
I know.
episode of the Grow Clinton podcast. As always, I am your host, Andy Sokolovich, the president and CEO of Grow Clinton, joined by the one, the only, the lovely Jenny home from our office. Jenny, it's Friday.
I know. And you know what? I had two great visits today with two of our great members. So
Which members?
Dependable Drain.
Yeah.
And then also the Watani Club
Ooh,
of Clinton.
was my favorite person at the Watani Club there.
Are you talking about my mother?
Yes.
Yes.
Dolores.
My
Love
mom.
Dolores.
She didn't give me any food, though. I was really disappointed.
She's been in that club for a long time.
Yeah, she has, and she loves it. It's a great organization. They serve like 12 different charitable organizations. They do scholarships, and they're all over the place. I mean, they've got a lot of members, and they're all active.
Those ladies do not mess around. You
They
know
don't.
who also does not mess around, Jenny?
Who?
Miles Communications. That's right, folks. The Grow Clinton podcast is powered by Miles Communications. All your high-speed fiber internet needs. Check them out at milestelephone.com. Again, that's milestelephone.com. Also offering television and telephone services. If you want to have a landline, they can hook you up.
Landline. That's retro, vintage.
We were discussing that the other day. Many people don't have a landline anymore.
I know it's true. It's going to come back.
It is true. Well, today we got two amazing guests
We really do.
join us in the studio. Coming to us from Community Healthcare Incorporated, located in Clinton, Iowa, right next to Hy-Vee. You can't miss it. We have Tom and Ashley. Thank you so much for joining us in the studio.
Thank you for having us.
Now, tell me more about community healthcare. I see it all the time. I hear great things.
Yep.
What is going on in that building?
Oh, there's always a lot of stuff going on. I'll maybe give you a little bit about community healthcare overall, and then Ashley can talk maybe a little bit more about Clinton specifically. But community healthcare is a fairly qualified health center. That means we serve everybody in the community, regardless of ability to pay. And so we do primary medical, dental, and behavioral health services. And we have locations in the Quad Cities, down to Muscatine, up to Clinton. So we serve a significant portion of eastern Iowa. We came to Clinton in 2015, I believe.
Ago.
Yeah, almost 10
I
years
remember
ago.
it because I just started in my economic development career, and you were looking at, I think, 2 locations at the time, not for 2 different clinics, but trying to figure out which location to move into.
Yeah,
And I remember getting involved in that conversation.
Yeah, we were very fortunate with the location that we have right there next to Hy-Vee and centralized in the
So
community.
central. And
Yeah.
what I didn't know when I talked to you the first time that you take everybody in the community.
Correct.
Also, you have dental and behavioral health.
Yeah. So up here, Ashley was actually the first provider of services we hired here in the Clinton community. And so she's been here right from the start. And so I'll let her talk a little bit about the services available here in Clinton specifically.
Yeah, so it's been 10 years, August. I think technically August was our opening date.
You can lie to
Can you
us.
hear
We
me
don't
okay?
know the answer.
Okay, perfect. Yeah, so when we opened, we didn't do a whole lot of marketing because it was just myself, and the community didn't really know what we did. So at first, people thought we were in urgent care, but we aren't. We are a family practice, just like Mercy has a family practice. We see all ages, newborns all the way up until, 100. You can bring your kids, your grandparents, everyone. We do family practice, we do dental, we do behavioral health. Our behavioral health services are mostly telehealth. We don't have a provider in-house, but we do have several providers available through telehealth. And we have one counselor in-house, but several available by telehealth.
That's really important in this community, in all communities.
Ashley, do you have some initials behind your name?
Yeah, I'm a nurse practitioner, ARNP.
Okay.
Nice.
Yeah,
I
there you go.
graduated, my undergrad was at St. Ambrose, and then I graduated with my master's from UIC.
Very cool. My wife is a DNP. I don't know what any of these things mean.
Sounds important.
I just went to her graduation and cheered for her, but
Aw.
it's cool.
Yeah,
so-
it is. And it's great we have this in our community. I didn't, it's correct in saying that you serve people with insurance, without insurance. That's right, right?
Yeah.
We take private insurance, we
Okay.
take Medicaid, we take Medicare, we take non-insured people. We have programs. Tom can speak more to the specifics on those, but it doesn't matter who you are. We'll see ya.
Yeah, that's a common misconception that we can only see certain types of patients. The FQHC model is to be available for anybody. However, we do have a focus on serving low-income populations, and so that makes up the majority of our patients. About 90% of our patients overall fall into, below 200% of poverty, and so a lot of those patients are in the Medicaid system. There's a fair amount that are uninsured. If you are below 200% of poverty, you can apply with us for a sliding discount, and so we'll make deep discounts on the cost of the care. A couple other services that Ashley didn't mention. She actually has been spearheading our ability to do SUD treatment or substance use disorder, and so we do work with patients with addiction who need assistance in curbing that addiction and in coming.
How could I forget that?
Yeah,
We've been working a lot with the community this last year, especially. Mercy's clinic closed its doors. They were doing, I think they had 30 patients or more that we took over. And so we provide walk-in services for that. It's been really helpful. We have people they walk in and we're able to see them most of the time. We've been trying to work with a local hospital and the ER.
And I know that's you're trained, of course, highly trained, but that is such a gift to be able to work in that type in medicine at all, but then also when people are vulnerable and they come in and they need your help, that's just such a gift to be able to
you don't
do
want
that.
anybody avoiding care because
Right.
they feel like they can't cover the cost.
Yeah.
People
It was
need to be
really
taken
cool.
care of.
I think it was Tina who pointed it out to me that Illinois Primary Care offered a fellowship
Yep.
for opioid use disorder. And it was, I want to say it was maybe like a 12-week program with specialists from all over Illinois. And I followed addiction specialists from UIC in Chicago on the ground. They have
Oh, wow.
a van that they take out in West Chicago, and they provide addiction services. They hand out clean needles. They treat people for primary care in the van. That was very eye-opening what they could do and how little barriers there were for those patients. So that's something that I definitely wanted to bring to Clinton. There are
Because
a lot of
every
barriers.
community has that.
Well,
I mean,
it's evolving in how we look at that. A lot of opioid addiction is not necessarily street drugs, things of that
No.
nature, and it's all age levels and it's all income brackets, and so it's kind of evolving into more of a part of primary care versus what we traditionally thought of as an addiction center or those types of things. These with some of the pharmacy therapy that can be employed, it can be treated as part of a primary care provider's. Just there's a certain percentage of your patients that are going to be struggling with addiction. It might be alcoholism as well, or it could be opioids or other drugs. But that's something that. It's not just FQHCs, it's every practice that you have, every doctor's office. And so we felt like we've been out in front on that and making sure that service is available in this community.
No, much needed. And here's a little story. I would like to share stories
Do
on
it.
the podcast because I can, Yeah. But when I left the service, I was in the Air Force. When I got out, I had my second back surgery. Back then, they prescribed tramadol, which was considered at that point a non-addictive narcotic.
that's like an oxymoron to me.
So I grew dependent on that tramadol after years of being on it. And this is going through the VA. But I remember approaching the VA and I said, I think I'm addicted to this. And no, there's no way you can be. Well,
Yeah.
it was. And it was probably the worst 2 to 3 weeks of my life
Right.
when I weaned myself off of that. So It doesn't matter what position you're in your life. It doesn't matter your socioeconomic status. It doesn't matter how much money you make. You can easily become addicted to these things. And it takes a group of professionals to help you work through that withdrawal symptom and eventually become free and clear of needing those drugs.
And another thing is, it's a whole different time now. I mean, before there was no education out there to people who were maybe being prescribed the medications, and it wasn't as, like you're saying now, it's part of primary care. It wouldn't have been that in the past. Now it's come further where people are saying, well, this is primary care. People do get, have trouble with this. So that's awesome.
Yeah. And it's a part of what we do. Certainly, the majority of what we do is what you see in any doctor's office. We're going to do annual physicals. We're going to treat chronic diseases. We're going to do acute care if you have a sore throat or earache. So we're here like any other doctor's office. We want you to come and establish care with Ashley or her colleagues, and we're happy to see if we're your life cycle.
Life cycle.
Yeah.
What I was looking for.
Okay, sure. And then the same, our model is to do medical, dental, and behavioral health and wrap those things around the patient. So if you come in, you might see Ashley because you need an annual physical, and then you can schedule with our dental department the same day and go down and get see your hygienist or see your dentist. We do general dentistry here in Clinton. We have, part of the nice part about having a larger organization, we have other resources. So in Davenport, for instance, we have a pediatric dentist, Reem Owace, and she's got a very large practice in the Quad City area. She is going to be coming up to Clinton on a limited basis here starting on April 18th, actually, will be her first day here in Clinton. We have a lot of kids that come and see our dentists, and Dr. Horahan does a great job in our dental department here in Clinton. But there's a lot of kids that are beyond kind of a general dentist scope, and so those kids can go to Iowa City. A lot of times there's just no other access for Medicaid patients, and so
and here's the thing too. I mean, dental can become a medical problem. I mean, I'll tell a story. I was at a point in my life where I had no money, but I had a big problem. I needed a root canal, but I couldn't do it. I ended up losing the teeth.
Yep.
Because of that, because I did not have the funds to take care of that, and the pain that went along with that, and the length of time, and I didn't know I could go anywhere for that.
Yeah, it's a huge problem. And, you can talk to hospitals. They will tell you there's a lot of patients that end up in the emergency department with tooth pain, whereas they could come to our office and we'd be happy to see them and take them out of pain and get them stabilized.
Right.
And so, yeah,
On that note, we do take dental walk-ins for emergencies
We do.
on a set and wait basis.
Yep.
Are you open on the weekends then?
We're not.
Okay.
Yeah, unfortunately.
But that's good to know. So,
So if you see a patient and you determine that they probably need to investigate a surgical option to repair what's wrong with them, then you provide a referral to a larger organization like the university, or how does that work?
Yep. They have a sheet of different providers in the area and providers in Davenport, Quad Cities, and the university. Depending on your insurance, obviously, there's 2 dental surgeons here in Clinton, if your insurance is compatible.
Yeah, that's the biggest challenge, honestly, with the patients we serve. It's, there aren't as many, if we're talking dental, there aren't as many oral surgeons in our communities that are available. And a lot of times the capacity for, low-income patients just isn't there. And so a lot of our patients do end up going to Iowa City for care for something like dental surgery. But also, we track all the referrals. Ashley and her colleagues, we try to keep as much local as we possibly can. We've got a great partner with Mercy and have from the start of this clinic. And so we're proud of that partnership. And so we try to use local specialists as much as possible. But when you're working with uninsured or underinsured folks, sometimes that access can be difficult. So we're very fortunate in this area to have proximity to the university because they do kind of fill in the gap on that for a lot of our patients. And then when we have patients coming from the Illinois side, it could be anywhere from going to Chicago, going down to Peoria, Rockford, Morrison, so we manage that on behalf of our patients and
Just wherever
we get creative as much as we can. Because,
and for people who don't have, a lot of people, medicine is not a central part of their lives until they get sick, and then they may not have the information they need, or even it might be intimidating to even go to the doctor. And then, okay, so I go and then I need surgery. I don't even know what to do from there. So it's great that you have the capacity to do that, and that you can tell people, walk them through it, because that is intimidating.
Yeah. I mean, that's our model. We want people to come in and get established early.
Right.
So you have a regular routine place of care. So Ashley can monitor those things and run those preventative tests and identify disease states early and that sort of thing. But if you do need ongoing specialized care, we also coordinate that with you. And we do a ton of work around just who is taking patients, who has capacity, and making sure you get in a timely way. Yeah.
That's nice.
Yeah.
We recently started using community health workers, which we have one at our clinic, and I believe all the other clinics do. Sherry is our community health worker, and she helps coordinate different things like rides. She can help people sign up for insurance. She can give them local resources for food pantries. There's a lot that she's able to offer, and it's been a really good resource for our patients here.
Yeah. What you can do clinically for somebody's health, a lot of times, that's going to make up 10 to 20% of a person's health is what you can manage medically or clinically. And so it's all those other determinants of health. We call them social determinants of health. So it's access to food, having shelter, having, transportation, all those types of things. So we do a lot of work on connecting to our other nonprofit partners or other partners in the community to make sure that the patient gets those things as well, because, let's say you need to be on a medication to manage your disease. You're going to need to make sure that you have the right food to take with that medication.
Right.
Or if you need to store insulin at your home, but you don't have a home, or, you're couch surfing or something, how do you do that? And so we really try to bring resources alongside the patient through our community health workers or our other teams to just assist in connecting them to other resources that they can use.
That support is so important.
If I could ever find somebody that could explain to me how health insurance works, I'd love to interview them, because to me, it just boggles my mind, especially on the Medicaid side. So we had a gentleman that I knew personally, and he was on Medicaid, and he had his prescription card, and he was on about 2 or 3 medications, but he was looking for extra work. And I made a couple calls, and I found him some contracts that he could apply for and earn some additional money. And he came in the office and said, "Thank you for all your hard work, but I can't do it." I said, "Why?" He's like, "Because if I earn an extra $7.50 per hour, I lose all of my benefits." So shouldn't the system be tiered? Like, shouldn't it be built to allow individuals to succeed, but also prevent any major pitfalls, like losing all your health insurance because you make a couple extra bucks? I mean, it just seems like a broken system to me. But that's just Andy talking, and I'm not running for election for anything, but it seems broken.
One of our biggest populations that we serve at community healthcare is the underinsured. The people that they make too much money for Medicaid, and some of them are able to afford marketplace insurance, but marketplace insurance has deductibles, it has copays, so they may need to see a cardiologist and have a procedure, but they choose not to because they can't afford the copay. So they have insurance, they're just underinsured. We help them get the medication they can through our discount pharmacies. There's a lot we can do for them that other places couldn't necessarily do.
And the information that you have, navigating that as someone who is not, a person who is not familiar with the healthcare system, person who was healthy and then suddenly something happened, like my dad, I don't think he went to the doctor in 30 years. And then one day he was sick. We took him to the ER, and they came out and said he has leukemia. And so he had to go to Iowa City right away, right there. And my mom, my sister, and I just stood there staring at each other because we weren't aware of what is next. So having professionals in the area that can connect all the dots for you and give you that support, it means so much to the family and the patients.
Well, it does, because there's so much hidden in the fine print. Like, I get all my medication now through the VA, so it costs me nothing, which is great.
It shouldn't. You're
but
a soldier.
At one time, I was seeing a primary care doc that was outside of the VA put me on a medication. That medication was $200 a month. And that's with insurance.
Ouch.
So I called and I talked to somebody and they said, oh, call this 1-800 number and tell me when to sign up for whatever. It was through the actual manufacturer for the medication. It went from $200 to $15 a month.
Oh, yeah.
But I would have never known that.
Right.
Because it's not listed on anything. They don't tell you about it. It wasn't for the nice lady that I called at the doc's office that told me to give the manufacturer a jingle. I didn't have to provide any kind of pay stubs, no proof of income, nothing. I just had to fill out a one sheet online and boom, I went from $200 to $15.
Right. And that's why you need.
Yeah, our nurses are
Yeah.
amazing. They know the ins and outs of all that stuff, the different programs for each manufacturer. Just talking to the patients for a few minutes, they can tell if they can apply for this program or that program, or if they need a manufacturer's coupon, or, if they qualify to use the community health discount. They're amazing. We have a great
So don't
team.
be afraid. Don't be afraid to go and get something taken care of.
Yeah, I'm glad you bring up pharmacy. That's such a important component to allow patients to better manage their chronic diseases and all that kind of thing. And so we've operated a pharmacy out of Davenport for a number of years. We recently opened a pharmacy in our Rock Island clinic, and we'll be doing Moline very soon. But we also established a clinic-to-clinic transfer, so we can fill meds in our Davenport clinic and have them brought up to Clinton for patients to receive up here. The thing about ours is we're what's called a covered entity, and so we can access a program called 340B, and it was put in place to help provide discounts for low income folks. So similar program of what Andy mentioned is, a lot of our patients, if they fall in those low income categories, if they fill through our pharmacy, especially on name brand drugs, you're going to be able to get drugs down, especially for diabetes and other things where it's $200-300 a month or a 30-day supply. When we used our pharmacy, we can get that drug cost down to $20 or something in that range.
Much more manageable.
Much more manageable for our patients.
And when he says qualify for our uninsured patients, it's the most helpful.
boy.
They're paying full price for those pharmaceuticals, and sometimes they're $15, out of pocket for their whole month of meds. It's amazing.
Yeah, very cool. Well, we love what you guys do. Again, talking to Tom and Ashley from Community Healthcare, located right next to Hy-Vee here in the beautiful community of Clinton, Iowa. Is there anything else you want to share with our listeners before we close out this episode? Believe it or not, we've been chatting for nearly 23 minutes.
Wow.
Goes fast.
It does.
Just a shout out we have 4 providers now. Brooke Johnson, we have Audrey Hausman, and we have Shanna Krogman. And Shanna is probably the newest of the 4 of us. She's taking new patients. Come on over, get established. Shout out to Angie. She's our clinic manager. She couldn't make it today. She is amazing. Thanks for having us today. We appreciate being able to share what we offer to the community.
You guys did a great job. Tom, you probably can get some voiceover work. You got a natural voice there for radio.
Smooth
I appreciate it.
tones.
Yeah, I can just see that in a world.
Keith Morrison.
Yeah. All right, everybody. Well, thank you for listening to episode 95 of the Grow Clinton podcast, recorded on this day, 28th of March, almost April.
Whiz.
You know what April is?
What?
My birthday month.
I know that.
Party every day.
Party every day.
I don't know. I'm getting older.
You're bringing
so I don't
treats
celebrate
every
them as
day.
much anymore.
It's adult birthdays.
Yeah, the 19th, 43.
Baby.
Feeling it.
You're a baby.
Feeling it. I got a little arthritis, I think, going on in my back. I've had several surgeries, which I don't know, back surgery, you don't just get one.
Yeah, right.
You might as well get a punch card for those bad boys because one never does the job. But
Do you have our rewards program?
now I find myself wake up in the morning. I'm like, okay, it's going to take about 3 to 5 minutes before I can stand up straight because I just feel so old.
I always feel like I'm the human question mark when I get out of bed on the way to the bathroom. That's just my shape until I get there. I don't know. But wait till the white hair starts coming in. Then I'll talk to you.
Look at my beard and the sides of my head.
Oh,
the whites.
geez.
My dad came to visit. He said, "Man, your gray's really setting in."
Setting
I'm like,
in.
why don't you go back to Florida? All right, go down there and enjoy the beautiful weather. I know my gray's coming in.
see
I'm
it.
well aware. I own mirrors. Leave me alone. All right, everybody. Thank you again to Miles Communications for powering the Grow Clinton podcast. When's our next episode of this bad boy?
Oh, I think it's on Monday.
Oh, Monday.
I can't remember, but
yeah, they all kind of blend together
They
after nearly
do.
100 of them.
I know, but I think it might. No, I'm not going to say it because I might be
Don't
wrong.
ruin it, Jenny.
I won't.
All right, everybody. My name is Andy Sokolovich. Enjoy your weekend if you're listening to this. This is on a Friday. Have a great weekend. Stay awesome. We'll talk to you soon. See ya. Thank you for listening to the Grow Clinton podcast. Be sure to subscribe and follow us on all your socials. Until next time, see ya.
We're still alive.
Okay, let me stop that. Bye. And